everyone. This is Dr. Mo again here with Wink Orthodontic. I wanted to show you this case that presented to our office and how we treatment planned them. So their main concern was the crowding, and maybe when you look at it from the front, it's not too bad, but it's still not perfect. As you look at it from the side, you start to see those imperfections. I'll walk you through it one step at a time as usual. We'll start with the top and we'll see how that alignment is looking like on those top teeth. Now, this person is an adult. They have all their adult teeth and all the way back to the second molar, which is a good thing. We draw these straight lines on the biting surfaces to evaluate the alignment of the teeth. You can see that this person does have some misalignment. It's not too bad, but it's also there. If I were to draw it, it would look something like this. This is what their arch looks like versus this. This is what they're looking like right now, right? I don't know if that's accurate, but hey, I'm trying here. So the goal is to line up all these edges of the teeth so they eventually look something like this. And this is a case where I like to do aligners. I don't think this person needs to go through treatment with braces because they have all the adult teeth. They can go through treatment with aligners. So why not? Let's look at the bottom teeth to see if that changes at all. And just by looking at it here, I wouldn't say that my opinion changes. This can still be treated with clear aligners. Clear aligners being Invisalign or whatever different brand there is. There's so many companies out there these days. And what I tell patients is they're all more or less the same. It's plastic and it all works to move teeth. But it comes down to the user and how they're able to use it. The user being the doctor, planning the cases properly, but also the patient wearing the aligners as they should. Because if you don't wear those aligners, they do not work. You have to wear them all the time. Otherwise, you're really putting your time and effort to waste. So yeah, there's some misalignment on the bottom as well, and we can definitely improve that. And then when we look at the side teeth, you can see the bite is actually not where it should be. There's also a little bit of an overbite. Let's go through here and start to annotate on each one of those. You can see this gap between the top and bottom front teeth, and that's what we call an overjet. This adult canine cusp tip is not where it should be. This adult canine should be fitting right into this space here, and this premolar should be fitting right into this space. This tooth should also be fitting, this tooth should also be fitting right into here, and this molar should actually be all the way back here. So everything is pushed forward by the half a tooth distance, so or 3/4 of this tooth, 2/3 I would say, and then half of this tooth's distance. You draw a line here, how far away it is, it crossed half that tooth. And again here, half a tooth width, and 2/3 of a tooth. So everything up top needs to be pushed back a little bit. Everything in the front needs to be pushed forward a little bit. And we can do that with rubber bands. Now these rubber bands, let me clear all these out so we can see better. The rubber bands, they go from the canine and to the bottom molar, and the patient wears this rubber band. It pushes the top teeth back and the bottom teeth forward. It fixes this overbite, but also fixes the bite on the back teeth. You want the teeth to actually fit together like gears instead of sitting on top of each other. And I'll show you here. This is how rubber bands work. You can see this person has an overbite. So the top teeth are pushed out, the bottom teeth are pushed in, and there's this gap between the top and bottom front teeth. The rubber bands work the same way, whether it's braces or aligners, and you can wear rubber bands on top of aligners. You can see after a lot of compliance, wearing the rubber bands really well, the teeth are pushed back and they touch. The bite in the back is fixed. Everything fits together nicely. If you do aligners, you just have to wear rubber bands. And that's why I tell patients from day one, it's a commitment that you have to be willing to be a part of. You know, it's not something that I'm doing for myself. This is something that you're doing for you to improve the look of your teeth, but also the function of your bite. If we look at the bite and how it's looking now, you can clearly see the teeth are barely touching on the left side. Very light contacts, that's what the blue color means. We prefer to see a lot more yellow and a larger area of contact, but because the teeth are sitting on top of each other, only the tips of the teeth touch. Treatment for this kind of case usually takes 12 to 18 months. It depends on how well the patient wears the rubber bands and the aligners. That really makes the treatment successful or makes it fail and makes it take a lot longer than it should. We scan the patient, we get their aligners. That usually takes 3 to 4 weeks, and then we put on attachments on the teeth. And this is what putting on attachments looks like. It is very painless, and we just put on tooth-colored filling material. You can see this is an attachment right over here, another attachment right there. You can barely see them. They are tooth-colored, and it doesn't take too long to put on. They are removed at the end of the treatment, but throughout the treatment, they are there. And it's what helps the aligners stick on the teeth. So they are important to the success of the treatment, and they help us push the teeth into the right position. So once the attachments are put on, we give the patient 8 to 12 aligners, depending on what they're trying to do. So we see them every 8 to 12 weeks, whether it's easy for them to come in or not. Sometimes we just ask them to send us photos of the trays in their mouths, and we can follow up on treatment through that. If it's easy for them to come in, we can see them sooner. If it's a big treatment and we want to make sure everything's going well, we do see them sooner. If they are younger and we want to make sure that they're doing a good job wearing those aligners, then we do see them sooner as well. So we're excited to help this patient, and we're excited to see what their final result looks like, and we're excited to see what their final result looks like, and we'll keep you all posted.